So it's always an honor and a pleasure to get the opportunity to present the work of Elaine Gaudreau, because her work has changed thousands of lives and hundreds of lives of children in my practice. As Raman said, I'm a nurse in private practice, and my expertise is in treating children with autism and ADHD. And usually a child is seen in my practice after a pediatrician or a pediatric neurologist has diagnosed the child with autism spectrum disorder. And children will get that diagnosis of autism if they, can't hear me? Okay. If they present with deficits in social communication, and if they have repetitive, restrictive patterns of behavior or interest. So it was always treated as an educational / psychiatric disorder, but fortunately, we're moving from it being treated as a psychiatric educational disorder to a biomedical illness with many varying symptoms that may be amenable to treatment. So many people are suffering with gastrointestinal issues like diarrhea or severe constipation, bloating, reflux, excessive gas, and cramping. And often, children that have those symptoms, they're usually unrecognized and untreated. But even when one of those symptoms are treated, like severe constipation, it's often treated with medications that sometimes provide the child with some relief, but doesn't do anything to look at the underlying problems of why that child is constipated. And so there's a new way that we're thinking about autism from a primarily brain-based disorder that's unchangeable and lifelong to the new paradigm that's looking at problems that are originating outside the brain. And in my practice, what we look at is the gastrointestinal system. Because we're seeing dramatic improvements in children with autism when we implement dietary interventions. And we're not only seeing improvements in their bowel function, we're seeing dramatic improvements in symptoms you wouldn't necessarily describe as GI issues. So anxiety, OCD, repetitive movements, language delays, and even their cognition improves. And we're also seeing improvement in their chronic inflammatory skin diseases. Their chronic infections resolve. I've seen plenty of children that have been given all sorts of pills and potions and for treating chronic eczema, when in most cases they need a change in diet and they need probiotics. So we implement the dairy-free version of the Specific Carbohydrate Diet to heal the gastrointestinal issues, to get at the source of the underlying problem. And this dietary intervention is not just for people with autism, because the common thread that's uniting children with autism with people with autoimmune disorders and maybe even people that are diagnosed with psychiatric illness is that there's chronic pathogenic bacteria or abnormal bacteria. Microbiome, as Raman mentioned, that's the new hot topic. And microbiome, it refers to the bacteria that's living on your skin and in your body. And the human microbiome may have a role in not only autism, but autoimmune disease such as diabetes, rheumatoid arthritis, MS, and fibromyalgia. Because just 20 years ago, it was thought that the immune system and the central nervous system didn't have any important interaction. They've known for some time that the gut and the brain is connected just based on the fact that you know when you're hungry you have an appetite. But the immune system and the central nervous system they thought didn't have any important interactions. But now it's emerging as a new area of research. And in the past few years, there's a new appreciation of the beneficial bacteria. So people for quite some time have been looking at pathogenic bacteria, but now there's a new appreciation for the beneficial bacteria, that it's not just benign and just moving through our systems. It can control certain aspects of our biology. And they're still discovering how bacteria can communicate with our immune system and not only affect the brain, but by the vagus nerve, but there may be multiple pathways in which the immune system is, in which the gastrointestinal bacteria is communicating with the immune system and the brain. So although the microbiome is fairly new and it's in its infancy now, the study of the microbiome, it's now may become central to the practice, not only in gastroenterology, but pediatrics, allergy, cardiology, and dermatology. Raman told you about the history of Elaine Gaudreau, and I was very fortunate to have met her and have learned from her. And as Raman said, she was a homemaker, minding her own business, and was forced to be a researcher and scientist after the medical establishment failed her in the treatment of her daughter's colitis. And she spent about 30 years trying to bring it back into public consciousness, even though she was met with great resistance. I met her when she was 82, and she was very powerful. She met me at the Seacrest in Falmouth, and we had a small conference. And by day 4, I was wiped out looking for a nap, and she was power walking past me. She had a mission. And although she was met with great resistance, you know, she continued on. And what she was trying to teach was a very simple concept. In fact, in my practice, we were teaching people about the gluten-free and casein-free diet. And it was a parent who introduced me to Elaine Gaudreau's work, and I wasn't really interested in learning another diet. I have a son with autism who was very sick, and I had a full-time practice. But thankfully, this mom was so insistent that she purchased the book, left it on my desk, so I went home and read it. And fate, or whatever it was, I was able to find some people who knew Elaine Gaudreau, and I called her up. And so at 82, she said, well, I need to come and plant my seeds, so I'm gonna, she was in Toronto, she said, I'll just drive down and see you. And that's what she did. And so I had the opportunity to spend some days with her and then travel later with her and speak with her. And what she was trying to teach us is that there's problems with the intestinal bacteria, and what you need to do in order to heal the gastrointestinal system is change the bacteria. It was that simple. And when we read it, and some of the researchers, the first reason why I didn't think that the diet would have as much of a tremendous effect as it was having, because at that point with the gluten and casein-free diet, there were people, the top researchers and scientists and neurologists in the world that were specializing in autism. They were meeting in one room each year trying to figure out what were the best clinical treatments for children with autism. And everybody had missed this simple concept about what Raman taught you in all his analogies about the fermentation in the gastrointestinal system and how not to feed it. And I'll talk a little bit about the gluten-free diet because I saw a lot of hands. I'll talk about that in a minute. But I wanted to just talk a few minutes about the GAPS diet, because since Ron and I are your emergency speakers today, and the previous talk was supposed to be focused just on the GAPS diet, Dr. McBride she was a neurologist and became a clinician treating children with autism after her son was diagnosed and recovered using the Specific Carbohydrate Diet. And so she opened a practice that included people that had psychiatric illness, so people with bipolar disorder and schizophrenia. And what she was finding is that they were responding to the same treatment as children with autism. They had the same underlying gastrointestinal issue that she was seeing in autism. So she wrote a book called The Gut and Psychology Syndrome, therefore GAPS. And then her patients started to rename the diet the GAPS diet. So the GAPS diet is not any different than the GAPS diet is the Specific Carbohydrate Diet. It's Elaine's work, and even in Dr. McBride's book, she wrote about it. It's Elaine's work. It's the Specific Carbohydrate Diet. But what Dr. McBride brought to that diet is she highlighted the use of fermented foods and probiotics, which are completely consistent with SCD as well. But when you're working with certain groups of people, sometimes, I don't like to use the word modified, because sometimes what happens is you're giving a protocol, and then people modify it, and it doesn't work, because the foundational concept of the specific carbohydrate diet you cannot modify. So you can't eat mostly SCD and some starches, and I'll get into the details of that. But so what Dr. McBride did is she highlighted the use of probiotics and fermented foods, and Raman and I, since that time, have done the same, because when you're treating a certain group of people, so with the practice that I have, it's mainly children with autism and ADHD, and for those children, they cannot tolerate dairy. The specific carbohydrate diet allows dairy, but what I find in clinical practice is people with autism and sometimes people with autoimmune disease, they cannot eat the dairy for at least 6 months. So we do a dairy-free version of the specific carbohydrate diet. So we start with the dairy-free version because of the foundational concept of the diet. When a person doesn't have the ability to break down certain carbohydrates, it can feed intestinal bacteria, and then when you feed intestinal bacteria, it can overgrow, and just like Raman showed you, the overgrowth can produce all these gases and acids that further injure the intestine, and so that's why Elaine named it breaking the vicious cycle, this huge cycle of inflammation and maldigestion and malabsorption and injury. But I did want to just talk to a few minutes about the beneficial bacteria, because it's such a hot topic, and because people have studied the pathogenic bacteria but have not paid that much attention to the beneficial bacteria. And now you see research article after research article and YouTube, lots of YouTube videos out there now about the importance of the beneficial bacteria and how you can have this sort of avalanche effect of bad things happen to you if you're missing beneficial bacteria. For instance, you cannot absorb and digest your food without beneficial bacteria. It helps you create your B vitamins, your B1, B2, B6, B12, folic acid, vitamin K. Those are all produced by the beneficial bacteria. The beneficial bacteria also plays a huge role in detoxification. We've known for years that children with autism are deficient in sulfur, and sulfur helps you detoxify things not only from the environment but from our own bodies. And so for years people were thinking, well, why are children with autism so deficient in sulfur, the one thing that they need to help them detoxify? Well, it looks like it could be this huge sulfur-eating pathogenic bacteria that's eating the body's sulfur. You don't have enough to help you detox. And where that becomes even more important is our bodies produce our own toxins from things like our neurotransmitters. So neurotransmitters like dopamine, serotonin, norepinephrine, those are the things that help you feel happy, have to do with sharing and love and feeling not anxious. So you can see that basically anything you do or feel is regulated by your neurotransmitters. So you can see that just not having the correct beneficial bacteria, what an avalanche effect it can have on your system. So Raman spoke about leaky gut, and we must have had ESP last night, because I was just putting in, as if you haven't seen the gastrointestinal system, that to picture it like a sausage or a New Bedford linguiça. So it has that thin, casing where it's tight, it's sealed, but it's still permeable. And some things can open up that permeability. So abnormal bacteria, maybe even low levels, if you have low levels of vitamin D, certain medications, those are the things that that can cause leaky gut. This doctor here, Dr. Robin Chutkin, she spent many years as a mainstream gastroenterologist, and so she's on YouTube. She has a great video. She's admittedly saying that most of her practice for 20 years, what she did was prescribe medications and send people for procedures. that was what she did to help people with inflammatory bowel disease. Until her patients started to find the Specific Carbohydrate Diet online, and they were coming in and reporting to her how well they felt. And at the same time, she was having, she had a young daughter who was experiencing chronic infections, and she kept getting one round after another of antibiotics for ear infections and throat infections. And so that was happening at the same time. And so she was able to, because she's a gastroenterologist, she was able to scope the people who were reporting that they felt better, and she saw actual healing in the gastrointestinal system. So as you can see, she's made the big jump, because now she's gone from mainstream to talk about toxin flushing. But she has a great YouTube video online. So here's the gastrointestinal system. And what's important about that is to, in order to understand how the specific carbohydrate diet works, you really do have to picture that long tube that starts with the esophagus and ends at the anus. You can picture it as one long tube. So there's your stomach, the small intestine, the large intestine, and then so that lining is what Raman was talking about, where it can become permeable. So we used to think that that lining for the gastrointestinal system had this tight junction, so that things stayed within the intestine and they didn't leak out into the bloodstream. Now they know that certain things can take this lining, this casing, and open it up so that things can go into the bloodstream. Toxins and viruses and bacteria can open that up and cause all the things that Raman talked about. In my practice, we run something that's called a comprehensive digestive stool analysis. And it's a test that looks at your gastrointestinal system. So it can identify inflammatory bowel disease, but it also looks at specifically beneficial bacteria versus pathogenic bacteria and yeast and parasites. And most of the symptoms here, when somebody has an abnormal comprehensive digestive stool analysis, these are the symptoms that we see, whether it's a child or an adult. Usually I see women in my practice, because usually I see women just secondary because I'm seeing their children. And sometimes if they're suffering with GI issues, I'll see them in addition to seeing their children. But the important reason why I wanted to share this slide with you, because as you can see, many of those symptoms you wouldn't necessarily attribute to a GI issue. So depression, anxiety, poor sleep, those are things that are often treated with psychiatric medicine instead of diet. And so if anybody's experiencing anything like that, including inflammation, you really should look at the gastrointestinal system first. So this lovely lady is Kelly Barnhill, and she's from the Johnson Center for Health and Child Development in Austin, Texas. And they do research. They not only have a clinical practice, but they do research to identify the best clinical and nutritional practices. And Kelly's the director of that program. And one of the frequent criticisms, especially from the families that I see in my practice when they see their primary care physician, their pediatricians, is that, where are the formal studies that show that a child with autism would benefit from a specialized diet? And so we decided to meet that head on. And we collaborated in 2012 to design and implement a pilot study of 25 children on the autism spectrum. And I wish I could give you the results, but it's going to be published soon. We're hoping now this summer. And so our hope with that is that when people see those results, they will now at least consider dietary interventions as a first-line treatment at the major diagnostic centers and hospitals for people who are treating children, whether it's autoimmune disease or autism. This study was specifically for children with autism. So I'll just review, Raman talked about the monosaccharide and the disaccharide and the polysaccharide. You know, as he discussed that people with GI issues can usually tolerate fats and proteins. That's not the problem in terms of causing an overgrowth of pathogenic bacteria. It's the carbohydrates that people have to pay attention to. And here's this one slide really teaches you what to eat. Because although it looks complex, it's very easy. So on this diet, you can have single sugars. Single sugars, they go through the intestinal wall. Even if it's injured, it doesn't matter. It doesn't need a lot of help for digestion. These single sugars are honey, fruits and vegetables, period. The problem lies when you have a disaccharide or a polysaccharide. A disaccharide's coming in as a double sugar, so this is milk sugar, table sugar. It's coming in like this. If you have inflammation, you do not have the ability to break those things apart to single sugars. That's what can travel through the system. There's a sparse amount of bacteria in the small intestine, but the colon is loaded. So now it didn't get broken down. It's going to go where there's bacteria who are going to feed off the sugar. And when you feed off the sugar, when the bacteria feeds off it, it overgrows. So polysaccharide, so disaccharides, milk sugar and sugar. Polysaccharide is worse. You can see it's actually a lot more complex. That's a simplistic view of it. It's starch. So it's potato, including corn, rice. So I should actually probably talk about the gluten-free diet here. So for many years in my practice, we were implementing the gluten and casein-free diet, and some children did well. And when we started to implement the specific carbohydrate diet, I went back and looked at who were those children that did well and what were they eating, because mostly what we were seeing is children did well, they didn't do so well, they did well. You know, so we knew we were missing something, we just didn't know what. Well, the gluten and casein-free diet, if done correctly, gluten is the sticky protein in wheat, barley, oats, and casein is the protein in milk. So cheese and butter, ice cream. So what we didn't realize was happening when you pull those two foods out of a child's diet with autism, or even any of our diets, gluten and casein, when you pull those two out, what most people do is substitute that with gluten-free foods. So they're eating corn, rice, and soy. And we used to advise that patients would do that. So you can see that's corn, rice, and soy. So the parents, the children who seem to get better is when parents pulled out gluten and casein, they didn't replace it with anything. Their kids ate meats, fruits and vegetables, the SCD. So when we went back to look at it, the children who did better, you know, were the parents, but not by knowing, but just by implementing a better diet. So I would warn the people who are doing a gluten and casein-free diet, one of the first things to look at is if you're taking out gluten and casein, be careful what you're substituting it with. If it's corn, rice, and soy, and you're trying to treat a bacterial overgrowth, it's probably not the greatest way to implement the diet. So if you're going to do a gluten and casein-free diet, stick mainly to the fruits and vegetables and meats. So the specific carbohydrate diet allows foods that the body can digest, the certain carbohydrates, so it's the monosaccharides and not the disaccharides or the polysaccharides. Oh, so these, I should tell you here because they're on the slide, those are absorptive cells, and that actually came from Dr. McBride's book, The Gut and Psychology Syndrome, and I thought she did a nice job of looking at the absorptive cells. So that's a healthy one with all the hair, and it's supposed to be digestive enzymes, and that's a sick absorptive cell when the lining of the intestine is inflamed and not working right. So what can we eat? That's the big question. So it's mainly beef and lamb and pork, poultry, fish, and eggs for protein, frozen and fresh fruits and vegetables, nuts and seeds, there's a whole list of beverages that are legal on the diet. But where people get stuck is when people like foods like pancakes and muffins and banana breads. On this diet, you can have it, but it has to be made with an almond flour or coconut flour base. So no gluten-free flours are allowed on this diet. So it's either almond flour or coconut flour.
Excuse me, you said no gluten-free flours or?
Yeah, so for the gluten, so like most of the gluten-free foods are made from rice flour, and that wouldn't be allowed. It's a polysaccharide. So it would just, you would just need, you know, almond or coconut. So this is a typical menu on the Specific Carbohydrate Diet, mainly for children. So eggs and almond flour pancakes and muffins for lunches, some choices of soups and salads. And for the younger kids, they like to bring to school chicken nuggets and lettuce wraps and chicken salads. For dinner, many families do crock pot meals with vegetables. There are families who cut up carrots and squash and make that sort of a faux fry if a child had already been used to eating French fries. And then there's a whole list of snack foods available. I think, you know, the hardest part when somebody's trying a specialized diet is the transition. For many years, when families would visit my practice, they would be so eager because they had sick children to go home and do it immediately. It almost never works that way. Preparation is key, whether you're doing it for a sick relative, yourself, or a child. If people get hungry, they call for pizza. And so even if it takes a family, even if it takes a family a full month to get all of these things done prior to starting the diet, that's what we do, because what you want to do is, if it's for yourself or for a child, is to really set that person up. It's not that it's difficult, it's not impossible. So in terms of transitioning, so you want to set yourself up or a child's family up for success. And here are some of the things that families have reported to me that have been the most helpful. So number one, organizing the kitchen, so not going home and throwing everything away that people are used to eating, that you really take some time to organize your kitchen. People do well on the diet if they have a stainless steel pan, cast iron pan, and a great food processor. Those, I would think, are the three things that are really necessary, or it makes your life so much easier on the Specific Carbohydrate Diet. And then you spend some time really looking at the menus. Ramen has created a website called SCD Recipe, and it is phenomenal. There's alphabetical categories of food. So if you like apples, then he gives you 10 recipes with apples in it. So it's phenomenal. There's lots of recipes on there that then people can create menus from the recipes. And then in terms of the specialty, because somebody was saying over here, in terms of the specialty items, those are the things that you want to have in your cabinet before you begin the diet, because there's only a handful of things. Most of the stuff you can get right at your grocery store, but things like coconut flour, almond flour, ghee, which is the substitute for butter if somebody's doing a dairy-free version of the Specific Carbohydrate Diet, and alcohol-free vanilla, and coconut oil. Now the grocery stores have coconut oil, but both How on Earth and Down to Earth sell ghee, and both, actually, I was just saying to somebody, I saw almond flour in Job Lot.
Yeah, they have a full
Yeah.
range.
Yeah.
Red milk.
Yeah, and we were just talking about, you know, many years ago when I approached one of the local health food stores about, could you order almond flour in big bulk? It's very expensive now, it's coming from California, and at that point you had to buy something crazy like 16,000 pounds of almond flour. But maybe with a couple of health food stores and some collaboration, because probably for us in this area, we could probably be getting it half the price. You know, so maybe it's worth talking to some of the sponsors about it, because there's certainly a huge population now in this area that are following both the gluten-free diet and the specific carbohydrate diet. Let's see, what else did I have on here? Oh, so there are several families who are using this strategy of, and it came from this gentleman who was telling me that he was raised with a single mom. She had a bunch of kids, 6 or 7 kids, and she worked, and he was talking about the food he was eating, and I was like, well, how did she even cook? And he said the process that she used was that every day of the week was identified with a food. It's brilliant. So Monday was always hamburger night. Tuesday was always turkey. Wednesday was always steak and beans. Not only does that make it easier for cooking, it's great for kids with autism because they like the predictability of that, whether or not they like the food. They like that schedule of that. But it's easier on you know, the families if they're having to shop for it. If everybody doesn't have that same thing, you know, song that you play of what's for dinner in your head. I thought that that was great, so I passed that along to families, and plenty of them are using that. Introducing this entire way of eating. So I don't know if any of you have teenagers at home, but sometimes I have women come in and they want their kids to eat different. And it's always this struggle of, you know, I want them to eat healthy foods. But I had this friend who, after she lost her best friend with leukemia, she wanted to start to eat better and understand a little bit more about health. And so she learned about the specific carbohydrate diet, but because she was at the point in her life, she had just turned 50, that she was going to do it for herself, it wasn't about her kids, that she went home and told her children they could not eat her food. So she cooked for herself, and she made breads, but what I witnessed through that is, you know, those kids wanted that food. So it's amazing on the different ways that you can, strategies that you can implement, but I learned a big lesson. I can't see far.
10 minutes, sorry.
But it is easier than once that she was feeling well, and it took her a month or so. Then she allowed her children to eat the food, and then it became very easy for her to cook like that for the whole family because they were dying to get at it when she told them they couldn't have it. Some of the things that help mothers who are busy and who are working stay on SCD is getting lunch boxes for themselves that they don't leave in the car, or a Shaw's bag or whatever, getting something that's important for them, that they pack their food, getting things like organic frozen fruits and vegetables that you can find so that there's less waste when you don't, if there's a week that you can't use it, and making smoothies in the morning. There's also moms who've given me a list of things that they take in an emergency, because it's always great to plan, but as you all know, there's sometimes you're running out the door and you haven't packed your lunch. And so things like that people keep in stock are boiled eggs, avocado, definitely fruits like oranges and ripe bananas that you can grab, but also things like canned salmon and chicken. People use those and keep those stocked in their pantry in case they're running and they can't prepare for lunch. And then also, this is the perfect time to introduce new dietary changes if anybody's interested in doing it. We often find when families come in, I don't even do it anymore, families were coming in November and December, forget it. With the holidays and parties and school parties, it just made everybody crazy. So if somebody comes in November, December, we ask them to come back in January. In springtime and summertime, with cookouts, you can have hamburgers and some homemade sausage and things that other people are having on their grills. You could have that on the specific carbohydrate diet. So Raman's lovely wife is in the back there, Neelu, and she helped us quite a bit. Raman and I developed an SCD dairy-free guide and cookbook for families. And Neelu and I undertook this process where we wanted to see how long it would take us in the kitchen to prepare food for a couple of weeks. And the amount of hours is 4. It cost almost $300, but we had enough food to feed our families for 2 weeks. So we did not cook the eggs, for breakfast, but everything else and we put that whole process in the book. From the minute you wake up, what can you do? You're done in 4 hours later. For families who have young kids, we say, get somebody to take the children out of the house, because that's one of the complaints of, oh, there's so much cooking to do. Families are successful if they take all that cooking and put it in one day. Not that you have to always cook like that, but it's great to have to cook in bulk so that there are always a couple of banana breads in the freezer and when people are hungry, and blueberry muffins and those things that you can store in there, and that way you can catch up week to week for cooking. And here's some just pictures that I just took with my phone of some of the food that we're cooking. So part of what I hadn't talked about is the introductory diet, and I'll just do this quickly because this is in Elaine Gaudreau's book and in our book as well, because if there's any chance that somebody can do this introductory diet, it really helps the healing process. It will soothe the gastrointestinal system. It helps stop diarrhea. It can clear constipation. But the problem is that many people cannot tolerate the introductory diet. So for the young children that I see, many of them are gagging on anything that's soft and mushy. They're like crunchy kids. They eat crunchy food mostly. And so we cannot start here. It's best to start here, but most of the time we cannot for young children or for women who are carbohydrate cravers. Because if you can do 3 days of soups and eggs and bananas, that's great. That's the best place to start. But if you're somebody that's already thinking, there's no way that I can manage that for a day or two, then what we do all of the time, and it's what I did for myself as well, is start on the full diet. You start on the full diet that allows you to have those things like blueberry muffins and breads. And then once you take starch and sugar off the menu, many people just naturally expand their diet to more fruits and vegetables, because you can't have anything boxed or processed foods. You can't eat it, and so you just normally start eating lots more fruits and vegetables. You're detoxing a little bit slower, and then you can work backwards into the introductory diet, and that's what we do more often than not for young children. It's very rare I get children that could eat soups. So, so I forgot to say that the difference between what Elaine Gaudreau initially developed for people with Crohn's and colitis and IBD is that she allowed dairy. So dry cured cottage cheese is included in her diet, and for us, we had to take that out for people with autoimmune and autism. So what we added in is the ability to give people more calories with pureed fruits. So am I almost done?
Yes,
Yeah.
we can do a Q&A for
Okay.
a little bit. We're going to go over the 12:15 time, but
Okay. Let me just get
everyone's
to the
welcome
real.
to stay and do a Q&A.
I'll just do this fast then. So for, I have never treated anybody that's a vegetarian on the specific carbohydrate diet, so I don't have any expertise, but I added this in because Dr. McBride has. And I had one little boy that came in, but the parents then ended up adding meat, so which we could do. But she said that it is possible. It's more difficult, but it's possible. But it would have to be a person who could tolerate a lot of fats. So ghee and butter and coconut oil, full fat foods are added in place of meat. So there are some resources in the slides. Okay, so the last slide I'll do is the most important of the Dieoff reaction, because I just saw this woman who had just walked into my practice. She wasn't a patient of ours. She just walked in, just so adorable. She had gone on the specific carbohydrate diet, but she thought she was doing something wrong because she was bent over with gas. When you try the specific carbohydrate diet, if you're going to do the intro diet, try it on the weekend. Don't go into the corporate world or any place where there's a lot of people, because that is a side effect of good things happening. When bacteria die off, you're full of gas. And so that's often not talked about. But for this woman who came into my practice, she was going to quit doing the diet because she thought she was doing something wrong. So the first 3-4 days, you can expect that. You can expect fatigue You can expect to feel a little bit lethargic. You can expect to have a lot of gas and maybe some mood swings. In children, they'll often wet the bed, and they're fidgety and very ADD looking, you know, even worse. Whatever their symptoms are, makes it worse for a couple of days. Okay, I think I'm getting shut off. Yeah.
For adults who are not autistic, who
Yeah.
have gastrointestinal problems, is this a lifelong diet? Or?
Yeah. Yeah. Well, you know, for children, so far what I've seen is that there have been some children who can eat some foods that are not SCD legal as long as they're taking some digestive enzymes, and they do fine. In other cases, I've seen children go into school lunch and start eating school lunch, and they have a major regression. They have to come back on SCD. So Raman can talk more about, you know, adults, because like some adults, like Elaine Gaudreau's daughter, eats a regular diet, and she's fine. Sandra Ramaka, who we met years ago, she said that the diet was not a cure for her because she stays on it. If she, you know, eats other foods, it makes her sick. So,
Yeah.
we have more, yeah.
Yeah, as you said, for most adults, it seems like they stay mostly on the diet to manage things. There's some, I mean, I think with the original research with Dr. Haas and having an actual cure, it seemed to be mostly with children. I mean, there are a few adults, but I'd say the majority do stay on the diet. So.
I should say what the other positive thing that I am seeing in children is prior to the diet, children that with autism that are exposed to gluten and casein, so they drink some milk, you more often than not see a dramatic negative behavioral response to that. So tantruming, poor transition, OCD thoughts, those things happen. But what I am finding is the many years that the children are on a specialized diet, they can be exposed to that food and not have a major reaction. So it's a little reaction like, oh, I'm not feeling good, but it's not a major reaction, which is telling me that other things are healing because before SCD, that child could have not had that little piece of chocolate or that little glass of milk, could have not had it without a major behavioral regression.
What about autistic people who were never treated with the diet during childhood?
Yeah.
Is there any thought about what happens to them?
It's a great example actually from Pam's partner in practice treats adults with developmental issues. So there was one man who was 34 years old and literally banging his head for when he was a child. And they introduced the diet in his group home with a lot of support from the staff. And that stopped within weeks, like the head banging, and just kind of his mood calming. And his mom actually brought in a shirt where, like a men's large, where he would bite holes into the chest of the shirt. So all that agitation stopped. So you may not have, like, I guess those changes in cognition so dramatically, but the behavioral improvements are dramatic. So,
And we see that quite a bit.
Yeah.
So now what we do is now that we've seen so much improvement in the children, we're now collaborating. So she sees an adult with autism that has GI issues, that person then comes to my practice, and we treat them with diet when we're able to, depending on the residential placement that they're in or where they're living at home. But the young man that Raman's talking about, that staff was so well received the diet that we went there and we taught them how to do the diet. We did a little cooking demonstration, and they still do it to this day. And not only did he get better, but his roommate was eating the same food and had always chronic infections and some kidney problems, and then he was better as well. So mainly for adults, you know, if they have agitation, any type of self-abusive behavior, we're seeing dramatic improvements in that as well. It doesn't matter what age you are in terms of everybody can always get better. The age is shouldn't defer people.
So you got a question for us?
In your practice, are you also treating ADD and ADHD?
Yes.
With the same symptoms?
Yes. Yeah.
Do you have affiliation with any gastroenterologists or any recommendations about gastroenterologists?
Yeah, there was well, right now at Massachusetts General Hospital, there's a great dietitian. Her name is Kathy Malone. And so she was working with Dr. Fusignan, but he just left. So I don't know who's replacing him, but he just left. But he was not only supportive, but also in agreement of the specific carbohydrate diet. So he was wonderful, but he's in private practice, and I just haven't caught up with her yet to where to find him.
Especially, Kathy might have some other
Yes.
GIs she knows there that are also.
Yes, she will be your contact person because she also practices using the specific carbohydrate diet, so she's informed about this diet, unlike many dietitians. So she's specialized in this as well.
There's a local gastro doctor, Dr. Kevin Murphy, who knows all about the diet.
Can you say that name again?
Dr. Kevin Murphy. He's in Rosebrook in Wareham.
Yeah, great, thank you, yeah.
Can
Have
you
to go
repeat
meet him.
that so we can hear? It was Dr. Kevin Murphy
In Wareham.
in Wareham?
Yeah, Rosebrook Medical Center.
Rosebrook Medical Center.
I wanted to make a comment on two things. Genetically modified food, that is a huge
Yes.
contribution to ADHD. And also the chemicals that we put in food, really, the coloring adds tremendously to the violence in children.
Yes.
Okay, I want you to stop that. But I also need to comment, I was taken back by the tremendous amount of meat and also fish that I saw, because climate change, the number one contribution to climate change is 51% is our addiction to meat, and it adds 51% to climate change. And when you have a can of salmon, okay, and the high mercury in salmon because of being a fatty fish, most of that I wouldn't even consider eating that as food for my body in respect and honor. And so I suggest a whole plant-based diet, food, a clean diet would take care of it.
So this is a great question. I think it's almost like a catch-22 where
Mhm.
maybe the diet tends to have more vegetables, maybe because meat was listed first, but there is animal protein in the diet, which I haven't found a way to get away from yet without being very difficult.
Mhm.
So it really is this catch-22 of someone's life being, literally their intestines in a biohazard bag somewhere.
Yeah.
So I know there are, at UMass, the staff there that has adopted this diet, they are trying to look at more plant-based ways. I personally am too. I think that it's a good point. In terms of the fish, I know about all the warnings. We put those in the book to minimize exposure. But I really think it's a catch-22, because what do you do with a population that, studies have shown moms caring for children with autism literally have PTSD from their cortisol levels. So it's a balance, and I'm hoping in the next couple of years with some of the microbiome research, there will be other ways to kind of change that population of intestinal flora. Yeah.
I had a life-threatening diagnosis. I decided that I didn't want to do what the traditional medicine said. So I either choose vibrant, excellent health, or I choose death.
Right.
So it's a choice that we make.
Yeah. It's hard.
Okay, but the climate change, that if people don't get serious about it, we won't have a place for our grandchildren.
That's true.
Okay,
There's no
so don't
doubt.
take care of yourself. We will not have a place for our children whatsoever to live without masks and everything. They will not have the freedom that we have today.
Yeah, I
if
think
we don't look at it.
for this in particular, being mindful of using more fruits and vegetables, but also I think there's enough people looking at this now that there will be more plant-based alternatives in the future. So, you have a question?
I wanted to know about maple syrup and yams and sweet potatoes, but just as a commentary, because there's controversy over climate change and meat, meaning that if it is local, grass-fed meats are done with a farming aspect where everything is integrated, so that because mass farming either with fruits and vegetables or with meats, when it's all done in mass, it totally doesn't work and creates more climate change.
Yes.
Whereas local farms, where the animal fertilizes the earth and that whole scenario can work. So, not saying you should eat a lot of meat, but I just as a commentary. So, but what I wanted to know about was the maple syrup and sweet potatoes and
Yeah.
yams.
Yeah, maple syrup isn't on the diet. It doesn't seem to
Not.
react well.
Okay.
Nor are the sweet potatoes, which would be very helpful. Although we talked about people that have been on the diet for a while and they seem to rebuild their intestinal bacteria. One of the things people will try that seems to be okay later on is a sweet potato.
Yeah.
But when you're saying when somebody does have a healthy gut,
Yeah.
they can pretty much eat a full range of diet because, or.
Well, I guess healthy enough to
Yeah.
sustain that. Because a lot of people that have been doing this for years, they still don't seem to. Maybe their tolerance, they can go out and have grains for a week or 2 weeks or 3 weeks, but after a month they'll start not feeling well again, and if they continue, like symptoms will reappear. And I'm talking a lot from the IBD
Well, I
point
was
of
just
view.
wondering, because so many cultures are based on, say, rice, or, yeah, that is.
It is. It's huge. It's funny because